In our office, we look at patients not just how each eye sees individually, but how the two eyes see and work as a team. A child might be told that they're seeing 20/20 with each eye individually. When you try to work with these two eyes together, they're not functioning at all to coordinate vision when reading and when trying to scan across a line of print. Their two eyes are not on the same line. One might be on the line just below it, and they have no idea what they've just read. Their comprehension is affected as a result.
Some early signs you can look for when children are having some disconnect between their vision and visual skills and their intelligence is that they're very talkative, they have a high vocabulary, they learn their numbers very quickly. But then when they go back to school, their handwriting isn't as good and they can't perform. And as they get a little bit older, their testing skills aren't quite as good. But when you engage with them, they're almost like little adults. But they don't perform quite so well when they're testing or providing their homework. Homework takes way too long than it should compared to the other students or even other siblings.
It's often thought of these children are auditory learners. They're amazing at learning through their ears. You can read them a story, but don't make them read the story. It's thought that we learn 80% through our eyes in the classroom. If our eyes are not synchronized and performing well, the child will not succeed.
I also want to say is that if your child is avoiding any type of reading or any type of near-point activity, and they'll get up and they'll run around, ADHD becomes a common diagnosis, which isn't necessarily the case. And so if those are some of the symptoms that you're concerned about, it's a good time to take a good look at full, thorough evaluation.
Probably the most powerful tool that we use in the office for people who are out there wondering, does my child have this? Do I have this? We call it the Binocular Vision Dysfunction Questionnaire. We've recently added 2 more questionnaires specifically for the children. We have a 4 to 8-year-old questionnaire and a 9 to 13, which is really helping us identify the specific activities or tasks that those age group children are being asked to do in their school setting.